Hello guys, welcome to Luminous Med Clinic. My name is Dr. Emmanuel Okore. I'm your favorite medical tank crier. Last week, we discussed the top 10 rights of a patient within a health facility. If you've not seen the video, there is a link on the screen right now which will take you directly to the video. Do well to watch, like, share, and drop your comments. This week, we'll be looking at the top 10 responsibilities of a patient. This promises to be super interesting. Stay tuned. Responsibility number 1. It is the responsibility of the patient in providing complete medical history, both past and present, as well as history of habits, allergies, and even past medical interventions, if any. Over 50% of the diagnosis a doctor makes comes from the medical history. That means if a patient withholds some vital medical information or lie about his or her medical information, he or she will end up misleading the doctor. You know, doctors are not mind readers. They work with the information made available. So if a patient deliberately or otherwise withholds certain medical information that could have caused a huge change in the whole diagnosis, he will have succeeded in misleading the doctor. People come to the hospital, they talk to the doctor about issues, about information that they can't even tell their family members, knowing fully well that the doctor is going to keep every bit of the information confidential. As a matter of fact, part of the physician's oath talked about keeping patients' privacy confidential even after the patient is long gone. And it is also a patient's right that their medical information be kept private and confidential. So knowing all this, I don't see the wisdom in a patient withholding vital medical information from the doctor. It is the responsibility of the patient to be completely honest in providing accurate medical information, like we said, including history of their habits. Do you smoke or you don't smoke? Do you have multiple sexual partners or not? As well as allergies. Do you react to any medications? Do you react to some seeds, to some fruit, to some food? It is the duty of the patient to be totally honest, because dishonesty in medical history will mislead the doctor and put the patient in harm's way, or even lead to inability to make accurate diagnosis, in which case the patient will still continue with their problems. Some time ago, I had this patient, an elderly man. He came with myriads of medical complaints, ranging from abdominal pain to what have you. I talked to him, trying to get exactly what was wrong with him. And we've already finished with the history taking and even the examination. I was about to send him for some information, I was about to request for some investigations, when the man's son was like, "No, doctor, he has not said everything." I said, "Yes, he has not said everything." Lo and behold, this man had a very huge swelling at the scrotum, that's inguinoscrotal hernia, very big, and he was covering it up, and it was even beginning to ulcerate. It was the man's problem, not the pain, but he was probably too ashamed or too shy to tell me that this actually what the problem was. So imagine if the man had come alone, he did not come with someone who knows what the problem was. He would have misled me. And imagine him leaving the consulting room, leaving the clinic, going back to the house when the main issue has not been diagnosed. So it's important that as a patient that you be completely honest with your caregivers. Whatsoever you tell the doctor remains private and confidential, even long after you are dead. The information will not come out. It's that serious. You owe yourself the responsibility to be honest when next you come to see a doctor. Don't hold back vital medical information. Every information counts. Responsibility number 2. It is the responsibility of the patient to adhere to the treatment protocol and the hospital regulation. Maybe you saw a doctor and he prescribed medications and said these medications ought to be taken for 5 days. Then you took it for 2 days. On the 3rd day, you realize that you're fine. You stop taking the drugs. Maybe a week, 2 weeks later, the sickness comes back and people are asking, but you saw a doctor. Many patients will not tell people that I didn't complete my drugs. They will blame it on the doctor. So it is the responsibility of the patient to comply with the treatment protocol. Some patients who have some chronic illnesses such as diabetes, hypertension, and so on, who are placed on drugs daily, on daily medication, such patients are usually the culprits in this manner because they can get tired of taking the drugs. Meanwhile, these are the drugs that are controlling the health condition. So when they stop taking the drugs, what happens? The BP goes up, the sugar goes up, the illness worsens, and they'll blame it on the doctor or on the caregiver. It is the responsibility of the patient to always comply to the treatment protocol. And we also mentioned that it is also the responsibility of the patient to comply with the hospital regulations. Some hospitals will tell you the visiting time is from this and this duration. You don't. There should be no more than 2 visitors per patient, or that patient should not smoke within and around the hospital. These are rules that the patient ought to comply with. So flaunting such rules makes the patient irresponsible, sadly. Before we continue, if you've not liked this video, please kindly like this video, alright, and drop your comments as well. And for those of you who have not subscribed to this channel, please, I urge you to subscribe to the channel and turn on your notification. Let's go on. Number 3, it is the patient's responsibility to treat the attending healthcare team with respect and dignity. Last week, we talked about the right of the patient, which includes to be treated with respect and dignity within a health facility. The same goes to the patient and the healthcare team. The patient ought to treat the healthcare team with respect and dignity. It will be improper for a patient to be rude to the caregiver or to insult the caregivers, call them names, or do things to deliberately get them angry. So the patient is supposed to treat the health team with respect and dignity. Sickness is not an excuse for one to be disrespectful. As we accord the patient the respect and dignity that is due them, they also ought to accord us the respect and dignity that is due us. You may have heard about the phrase, respect is reciprocal. Yes, it goes both ways, so that both the patient and the caregivers will be happy at the end of the day. Number 4, it is the patient's responsibility to ask questions when in doubt. Do not assume. Do not experiment with your body. If you are not sure, ask questions. It is your responsibility to ask questions. No caregiver will snub you. No caregiver will fail to answer any question that you have asked. Ask your question, because if you fail to ask questions when in doubt, you may do the wrong thing that will put you in trouble. If you are giving drugs and it's been explained to you how long you have to take the drugs, but you are not so sure, maybe you've mixed them up, ask questions. If your doctor gave you certain instructions to follow at home and it's not quite clear, ask questions. It is your responsibility to ask questions. Funny enough, sometimes you walk into the ward, the patient's doctor has already done his ward round and left, and you see the patient asking the nurse or asking the orderly, please, this one, how do I do this? But the doctor was there. It is the responsibility of the patient to ask questions when in doubt. You don't understand the instructions, ask questions before you put yourself in trouble. Number 5, it is the responsibility of the patient to inform their medical team if there are changes in their health status. Some patients, when they are on admission, after having been reviewed by their doctor, maybe some moments later they discover that there are some other symptoms. Maybe they're now having headache, or their body is getting hot, or they vomited. It is their responsibility to inform their health team that, doctor, when you left, this and this is what I noticed about my health. Also, it is the responsibility of the patient to inform their health team if they are getting better. Yes, doctor, I'm getting better. I feel a lot better. This pain has disappeared. Feedback is always appreciated. We appreciate feedback so much. There are some patients that, by reason best known to them, they deliberately withhold such feedback. So they pretend as though the treatment is not working. I've come across few of such patients. There was like some elderly ladies, maybe they have been abandoned or ignored by their children, and then they now became ill and came to the hospital. Then everyone is around. The son, the daughter, their in-laws are around, and they've not had such attention for a long time. Trust me, these people, and a whole lot of them will pretend as though the treatment is not working, so that people will remain with them, because they know that the moment they are discharged home, everyone goes away. That notwithstanding, it is the responsibility of the patient to give feedback. Yes, to give feedback about their health, to give feedback about the treatment, to give feedback, because the doctors are even more worried than the patient. Yes, the caregivers, the health caregivers are more worried than the patient, because we want our patients to get well. So imagine when we've done everything that we know how to do, and the patient still says he's not feeling fine. Meanwhile, they are okay, they are fine. So it is your responsibility to give feedback. We appreciate feedback so much. Yes, we do. So that is the end of today's episode. Let's take a quick recap. We said responsibility number one, it is the responsibility of a patient to provide accurate medical information, both the past and the present medical information, including the history of allergies, history of the drugs that they are taking, history of their habits, and even history of the past medical interventions. Secondly, it's the patient's responsibility to comply with the hospital rules and regulations. Number three, to treat attending healthcare team with respect and dignity. 4, to ask questions when in doubt. And number 5, to inform the medical team if there are changes in their health status. If you've not subscribed to this channel, I urge you to do so. Subscribe to this channel, activate the notification bell. Also, like and share this post. Drop your comment. I will respond to all your comments and suggestions. So, see you in the next one. Bye.